The indications for hip replacement are basically always pain or loss of function. The variation, the balance between the two is, however, variable. And some people have got great function but terrible pain. Other people have got very, very poor function, not too much pain. The pain you get is generally in the groin. It goes down to the thigh, down to the knee, and sometimes below the knee. It's a pain which typically gets muddled with back pain, and there's no doubt that throughout the country a few patients each year have hip operations when they should have had back operations, and vice versa, have back operations when they should have had hip operations. And it's obviously important to get the right one. In terms of loss of function, you're looking at, limping, inability to walk any distance, inability to dress, and stiffness. They're the main sort of obvious functional disabilities. Well, I'm a relatively fast surgeon, I think, and so, and I have a sort of team around me which speeds things up, but we would generally expect to do a straightforward hip replacement in under an hour. If we're doing revision surgery or complex primary surgery, it could be going up into 3-4 hour periods. Well, again, it's a straightforward hip replacement, primary hip replacement. Patients, as we've said, it takes about an hour. I then like to get patients up walking on the hip the same day as surgery. I think it gives them confidence. They then spend a bit of time in hospital, usually 2 nights in hospital, which gives them a chance to have some physiotherapy. At the end of that time, about 20% of my patients can actually walk without sticks or crutches at all. And a lot can leave hospital then without even a walking aid. They then have physiotherapy and they walk more and they do exercises. And the majority of patients can probably walk half a mile by a month without any walking aids at all. Certainly they should be able to by about 6 weeks. Hip replacement is a major surgical operation, and inevitably it does have risks, which we have spent ages and a lot of work trying to reduce, and we certainly see them much less than we used to. You can get a fracture of either your femur or your pelvis when doing a hip replacement. Normally one could fix that at the time of surgery and would be just a single operation. One can get leg length discrepancies, which is one of the major complications. We do a lot of preoperative planning, and you can use navigation systems which are creeping in. I think are a good system. Other people are using robots, which I think you lose quite a lot of feel for doing the operation when you're using a robot. Hip replacements again can suddenly come out of joint and dislocate, which is a terrible complication as it brings the patient to a complete standstill. Basically, they have to attend an accident and emergency department and have the hip put back into place. Again, we can do a lot of planning beforehand to reduce the risk of that, but to completely abolish the risk of dislocation completely is difficult. Again, you can get an infection, which is one of the most severe risks of hip replacement. And if you do get an infection, you may need the joint to be washed out. You might need the components of the hip replacement to be removed and reimplanted. The risk of an infection is probably about 0.2%. And if you do get an infection and you have to have it revised, you've probably got about a 96% chance of getting rid of the infection completely. But it does leave a very, very tiny number of patients who could land up with a lasting infection. Again, while doing the operation, it is possible to damage nerves going down into the leg and foot, and those are very, very difficult to repair to recovery. But the risk, I think, of nerve damage is probably about 1 in 2,000, something like that. You can get a DVT, venous thrombosis, which can lead you to a pulmonary embolus, which could potentially kill you. However, of recent years, probably the last 10, 15 years, we've been anticoagulating patients in the post-operative period much more. And I think the incidence of getting a DVT and pulmonary embolus is really now very, very small if you take those precautions. I think a lot of patients find that the pain that they've been suffering from for a long time basically goes instantly, and so they're happy with that. Again, it depends how bad you are before. If you were walking with crutches beforehand, because then you would get a big functional improvement pretty early on. But if you were still able to be playing occasional tennis, then it takes you a while to get back to that level afterwards. And we wouldn't want people to be going back to sports with any impact on it really for about 3 months after surgery. But basically, we would be expecting people to be improving over the first 2-3 months, and by 3 months, we would expect them to be 90% improved. But there's no doubt that a hip replacement will actually slowly improve for up to a year. Other people have even said 2 years after surgery.